Hello. I hope this finds you well. My name is Angel Ekstrom. I'm the Public Health Emergency Preparedness Coordinator, as well as the Director for the Medical Reserve Corps, MRC, and Community Emergency Response Team, CERT, for Central New Hampshire. The Medical Reserve Corps and Community Emergency Response Team is a community-based team of trained medical and non-medical volunteers who promote healthy living as well as prepare for and respond to emergencies. The Central New Hampshire MRC and CERT are a part of a national organization that aims to organize and utilize volunteers. The Central New Hampshire region, whom the CERT and MRC serve, is made up of 18 communities. They are Alexandria, Ashland, Bristol, Bridgewater, Campton, Ellsworth, Groton, Hebron, Holderness, Lincoln, Livermore, Plymouth, Rumney, Thornton, Warren, Waterville Valley, Wentworth, and Woodstock. Our mission is to improve the health and safety of communities within Central New Hampshire Public Health Region by organizing and utilizing medical, public health, and other volunteers. Medical Reserve Corps and Community Emergency Response Team members are actively impacting the health of Central New Hampshire residents throughout the year in supporting non-emergency community events, regional public health initiatives, as well as community education. Members have facilitated community education sessions such as how to prepare for a long-term power outage. You may have interfaced with the Central New Hampshire MRC and CERT volunteers during the Shamrock Shuffle, New Hampshire Marathon, Hebron Fair, and Community National Night Out events, to name a few. Central New Hampshire Medical Reserve Corps members were part of New Hampshire's first response efforts in responding to the opioid epidemic that surfaced in 2015. They gave their time to be trained as community educators that focused on naloxone administration. Members traveled throughout the Central New Hampshire region, collectively working with partners such as the Communities for Alcohol and Drug-Free Youth, Katie, based out of Plymouth, Stand Up Newfound, and the Bridge Project out of Lincoln, conducting local community education and naloxone community events. Members also trained local healthcare providers in naloxone administration and distribution, affording naloxone to be distributed at agency locations. Central New Hampshire Medical Reserve Corps members support influenza immunization clinics, flu clinics in local schools, and most recently conducted mobile hepatitis A clinics in collaboration with local partners to address the outbreak, in which New Hampshire was one of 33 states that the hepatitis A outbreak occurred throughout 2019 and into 2020. Our regional volunteers support public health issues impacting our local communities, as well as educating residents and communities on how to prepare for emergencies. Members participate in trainings and exercises to build skills needed when responding to emergencies. They respond to local emergencies in our communities and help stand up and staff community shelters, points of dispensing, referred to as pods, alternative care sites, referred to as an ACS, and more. Recently, through the collective efforts of the New Hampshire Department of Health and Human Services, Spear Memorial Hospital, Plymouth State University, the National Guard, and the Central New Hampshire Public Health Network, our region has an alternative care site that stands ready if needed in response to the novel coronavirus, COVID-19. I am reaching out to registered nurses, RNs, licensed practical nurses, LPNs, licensed nurse assistants, LNAs, medical assistants, MAs, emergency medical technicians, EMTs, wilderness first responders, WFRs, and inviting you to join the Central New Hampshire Medical Reserve Corps that is helping support New Hampshire's alternative care site. Volunteers who step forward to serve will be oriented and trained. On-site orientations continue to be scheduled as more volunteers answer the call to serve. If this is the type of impact you want to have in making a difference in our local community, I encourage you to become a member of the Central New Hampshire Medical Reserve Corps. If you would like to help support Central New Hampshire's alternative care site, or would like further information about Central New Hampshire's MRC unit, please contact me. My email is aekstrom@midstatehealth.org. I can also be reached at 238-3602. A Central New Hampshire Medical Reserve Corps member application can be accessed online on the Central New Hampshire Health Partnership website, cnhhp.org. Once on the homepage, click on Volunteer, found on the upper right-hand corner of the website. Once on the Volunteer page, click on MRC CERT, and the link to the application is there. There are countless benefits in getting involved through the Central New Hampshire MRC CERT volunteer efforts. The impacts you will have in helping Central New Hampshire prepare for, respond to, and recover from emergencies will strengthen our community's health, improve our community's response capability, improve our emergency response capabilities, and build our community's resiliency, to name a few. By becoming a Central New Hampshire MRC volunteer, you will have access to free trainings. You will have the opportunity to help others, to give back to your community through sharing your professional knowledge and skills while you grow and become part of a team, as well as learn how to prepare you and your loved ones for an emergency. Central New Hampshire is closely monitoring developments surrounding COVID-19. We encourage residents to follow state and federal guidelines. For up-to-date information on COVID-19, please visit the Centers for Disease Control and Prevention and the New Hampshire Department of Health and Human Services websites. I hope this has offered a broader understanding of the efforts and impacts of the Central New Hampshire Medical Reserve Corps and Community Emergency Response Team, that it may have inspired you to serve with the MRC CERT, or will cause you to pursue a conversation regarding this call to serve our local community. Again, please don't hesitate to contact me if you're interested in becoming involved. Have questions about the Central New Hampshire Medical Reserve Corps, Community Emergency Response Team Unit, or the Alternative Care Site? My information is on the screen below. Thank you for your time and consideration. Take good care.